Hey, welcome to the Home Health Care Today show. I am your host, Dr. Cleamon Moorer. It's April, and April is National Minority Health Awareness Month. And we have the distinct honor of having a repeat guest to the Home Health Care Today show, Dr. Alvin Haynes. Dr. Haynes, welcome back to the Home Health Care Today show.
Oh, thank you, Clem. It's wonderful to be here. Wonderful.
Yeah. So it seems like we kick off quarters together, right? That very first television episode of the show back in January, you and the CEO of Meridian Health Plan, Patty Graham, joined us to kick it off. And now we're kicking off quarter number 2, April, together. For those of you that may have missed that very first episode of the Home Health Care Today show, the television show that is, Dr. Alvin Haynes, MD, MBA, is the Chief Medical Officer for Meridian Health Plan of Michigan. He's a senior fellow in hospital medicine, and he's here today to talk about Minority Health Awareness Month and some things for us to certainly consider. Dr. Haynes, when we think about Michigan, unfortunately, our state sort of lags behind, number 29, that is, in terms of health quality outcomes for minorities, right? When you think about Meridian being the largest health plan, the largest Medicaid health plan in the state, what does the month of April mean for you in terms of minority health awareness, as well as Meridian's role in helping to shape the outcomes for minorities in our state?
Well, thank you for asking that question. And I think the month of April, just like in our first episode, we were beginning a new year. In a very real sense, we are beginning a new year here in Michigan as the weather starts to warm up.
True.
Time of spring, it's this time of renewal, and it's time for all of us to take stock and take an interest in our own health care. So I think that this is an opportunity, really, as the weather starts to improve here in Michigan, to really take stock of some of those things that we discussed in that first episode. And if I remember correctly, we talked a lot about establishing with a primary care doctor.
Absolutely.
We talked a lot about prevention of chronic illnesses, hypertension and diabetes. We talked about eye care, some of the things that you do. We talked about physical movement and home health. And we talked about sunshine, if you recall that. And you said you might not be able to do much for the sunshine, but we actually have the sunshine now.
Sure do, Doc. Absolutely. What a difference 90 days makes, right?
It certainly does. So in all seriousness, this is really the time to really, as you can become more mobile, to really take stock of what are your chronic health conditions and how can you access the care that you need to access.
Absolutely, Doc. Yeah, so speaking of that, we got a pretty large state, we're in Southeast, but when you think about northern parts of the state, mid-Michigan, like the Flint area, Western Michigan, the Grand Rapids area, and you think about minorities and health outcomes, what are some of the challenges and how can we move the needle, around the state?
Yeah, so I think, there's a lot of barriers that you just mentioned in the setup to that question for healthcare, being rural, being isolated.
Yes.
Not necessarily having providers in your communities. And so I think that's what we try to do at Meridian, first and foremost, is that we really try to remove barriers to healthcare. And we try to do that in a number of ways. Yeah. Number one, I think that the simplest way that we do it is just really by trying to outreach our members through our care managers. We try to provide information through our websites. And through various community events where we can really get people engaged in their healthcare. But then as we go a level deeper into our healthcare plan, we really try to not only talk about it, but we try to walk the walk. And so we provide things like food for people who have food insecurity. We provide transportation for people who don't have reliable transportation to appointments. Yeah. And by doing so, we really are trying to build trust with our communities, because sometimes that is really what's lacking, is that people don't necessarily trust healthcare systems and trust healthcare providers at time, especially when they don't see them represented in their own communities. So,
Absolutely.
so we really are trying to bring some of those things down, and
Yeah.
as I know you do through
Absolutely.
the Mobile Eye Care of Detroit. So,
Absolutely. Thank you for that, Dr. Haynes. Yeah. So as we, think about, the minority populations, we had colleagues join us from Meridian, a few weeks back, and they focus on maternal health.
Mhm.
Now that I'm thinking about the seasons changing, and prior to us going on air here, we talked a little bit about allergies and asthma, right? And even when I think about COPD and some of those challenges that some zip codes may be, more impacted by negatively or affected by
Mhm.
versus others. How do we change this, Doc, where, hey, the zip code doesn't determine the health outcome we're going to help you, or Meridian is going to help to mitigate some of those zip code barriers and challenges?
yeah, I mean, I think it's an important point you bring up about allergies, because allergies can affect a lot of people as they are affecting you.
Yes.
And just as an example, to bring up about some of the medications that we use for asthma exacerbations in African American communities, they don't work as well for African Americans as they do for other populations. And so, but if you don't know that, and if a doctor does not have the cultural sensitivity to know that, they might not be aware. So it doesn't mean that we don't try those medications, but what it does mean is when they don't work, then we really have to start looking for alternatives. And so I mean, I think that is a perfect example. Again, you're right that different zip codes, certainly not only here in Michigan, but we struggled the same. I came from the Florida Health Plan. We struggled as well in Florida with outcomes in certain zip codes, and I think there's a lot of things that play into that beyond just genetics. It's really about the support of the resources of your community, the physical locality of care that you can get. So there's really a lot of things that play into that. And again, what we try to do as a partner at Meridian is really to try to break those barriers down. And I think the first and foremost is if you aren't accessing care as you wish, and you are a Meridian member, or if you're a member of any other health plan, really you should reach out to those health plans. If you don't have a provider, they can certainly help to guide you to the right provider, the culturally sensitive provider. I know that we at Meridian, what we try to do is to hire an array of physicians and providers and nurses and therapists that really are a mirror to the folks that are in our community. And I do know that within our plan, those care managers that are actually reaching out to our members really do reflect the breadth of diversity of our community. And I really, as I said before, I really think that builds trust. And when you can build trust in any relationship, then you really start to be able to make ways and make some gains, whether it be healthcare or whether it be anything else.
Absolutely, Dr. Haynes. I'm going to go bullseye with that. Whenever you talked about not only the medical professionals that mirror and resemble the community that Meridian serves all around the state, the community health workers that are beating the streets are so important too. That's a very important dynamic whenever we're talking to some folks that may be uninsured or underinsured, some folks that may say, hey, I relocated and I don't know who my primary care physician is, or I've ran out of a prescription. Being able to connect with folks boots on the ground in the community, ringing doorbells, that know folks by first name and know some of the local churches and the community centers, it means a lot. I've seen folks, I've connected with Meridian people on the streets. What is Meridian doing intentionally, Doc, to keep that workforce vibrant and strong as related to those community health workers?
Yeah, so I think the thing that we do incredibly well is we partner with organizations throughout the state, such as your organizations. We partner with Wayne Health, who takes a mobile van to different other community organizations that really serve as a conduit to get health care. So I think it's important that we support as you said, we support those organizations that are sitting in the community where people know the name, people trust the people that work at those communities. In fact, there's a lot of medical studies to suggest that that community health worker model or peers, your neighbors, your friends, your caregivers, not formal caregivers, but those types of individuals that are really well versed in preventive care can be more effective than the traditional doctors and the traditional nurses and things of that nature. So it's incredibly important. I mean, this is a big, these are big issues. They're difficult issues, but they're not insurmountable issues. And it really behooves us to engage as many partners as we can. And we really do try.
Absolutely, Doc. And I see it when we talk about that, not only the street credibility of the health plan, but that socio-cultural intelligence where folks can understand the whole tagline of Meridian, care above all else. But underneath care, which supports care, are just so many resources, right? And so many tools that folks can access. So prior to our commercial, Doc, do you want to just share some of the great tools and resources that people could access via mymeridian.com? That'll be great before we go into the second segment of our episode here.
Yeah, I think, I was on our website earlier before the show, and there is just a wealth of resources there to talk about our food as medicine programs, to talk about our transportation, to talk about our Start Smart for Babies. So we have a wealth of information. So I would highly encourage, people to, especially our Meridian members and those who need a health plan, to go to mymeridian.com to access some of that. And we can certainly talk about a lot of those programs in detail. They're wonderful.
Definitely, Doc. And then there's a lot of member summits coming up, right? So Metro Detroit, stay tuned for Southgate, Grand Rapids area, Ann Arbor. We're going to be going around the state, meeting with members, getting your own experiences firsthand. And for those of you that aren't members of the Meridian Health Plan, but are interested in the health plan, we're open to the public as well. Folks, we're headed to a commercial. We'll be right back.
Never in the history of healthcare delivery has an organization offered such complete care to Detroiters. Your eye care experience may begin in our state-of-the-art eye clinic, but it doesn't stop there. We can come to you. Delivering vision and home health care is the hallmark of the Eye Care for Detroit and American Advantage partnership. Helping you to feel better and see clearly is the perfect putt. Call Eye Care for Detroit today.
Every Saturday at 10 a.m., we bring the Home Healthcare Today show, hosted by Dr. Cleamon Moorer and sponsored by Meridian Health Plan in Michigan. We bring health and wellness topics straight to you. Tune in at 10. Welcome back to the Home Healthcare Today show. Yes, the first episode of April. And I have the pleasure of sitting here with Dr. Alvin Haynes, the Chief Medical Officer of Meridian Health Plan. We spent our first 12 to 13 minutes of the episode just kind of going over an overview of some common themes and topics as related to minority health and wellness. Doc, there's some caregivers out there, even though we talk about getting out to move and, the weather has changed, but there's some folks that are also homebound that aren't so easily able to get out and move. What are some of those in-home care benefits? I know we got some projects going between our agencies and Meridian, but what else is going on for that homebound population out there?
Yeah. It's really important that you are right. Not everybody can get up and move around, especially in our elderly populations, and those who have, sustained disabilities through prior injuries or prior medical illnesses and things of that nature. And we have a whole host of support for our members at home in general. We have obviously physical therapy services that we can bring at home for people who need short-term help at home to kind of teach them again on how to start moving around their environment. Physical therapists and occupational therapists, which kind of focus more on your day-to-day activities like bathing and stuff like that. We also have nursing for those that need help with things like medication management. For some of our members who really have complex needs, who are bedbound and things of that nature. But what we at Meridian have a lot of is what we call personal care services,
Yes.
and I know that you provide some of those, but personal care services, home nursing services, personal care services really support those members who can't do all of those daily activities. So they have real difficulty with, cooking meals. They have
Yes.
difficulty with bathing, may have difficulty with dressing, may have difficulty doing laundry, may have, difficulty going out to the store or things of that nature. And we really have these personal care services that can really help to support those members who have difficulty with some of those. And we also have, programs in which family members can be the ones who give some of those personal care services. So it really allows our members to have a loved one really assist them with the day-to-day needs and also provide some financial support to the household.
Absolutely.
So we really have a lot of members who require those services, and for those that qualify, we absolutely provide those. And I think it's a vital, life link for people who are getting. It also, some of those professional skilled services in the home can really teach members though how to move, because even though you're homebound, some people who are bedbound can't move, but those who are within their home can still do, and I think I mentioned this on the first episode, really to learn how to do small things that can increase your strength and your dexterity and your mobility, and really kind of have a can-do attitude, but also doing it safely. With the assistance of someone else. So we certainly provide all of those things, and for those who may think that they need some of that assistance, again, we will continue to say, reach out to mimeridian.com, contact your health plan. If Meridian is not your health plan, contact your provider to really look into these areas of support. So.
Absolutely, Doc. Yeah, I'm so glad you honed in on it. The activities of daily living is what Dr. Haynes was referring to there, and we know that from time to time, folks are at home and could get a little down on themselves and say, hey, I got a load of laundry that needs to be washed. I got dishes in the sink, right? I got some things that are just really on my mind. And then we have those same folks that have the daily chores or ADLs that are on their mind that might have just got discharged from the hospital and should be seen by a provider within 48 hours of discharge, or folks that didn't get hospitalized but went to the emergency room and need to follow up with a healthcare professional within 7 days. So those are definitely some projects that American Advantage is working on with Meridian to close those gaps.
And you just also reminded me of something else that I didn't mention, is those, loneliness is also an epidemic within our society these days. And so there are some folks who qualify for what we call companion care, for those really that don't have those social supports that others may have, and those who are unsafe in their own home. So some of our members that may have dementia or problems with memory or things of that nature. So I just wanted to also mention that too, as another support service to really allow our members to function in their home environment, because we know that the home environment is better than being in any kind of institutional environment when possible.
True, Doc. I put a pin there and a note, because we're gonna circle back to some of that loneliness as we fast forward and look at some upcoming episodes here in the month of April. So got a pin there. Promise to come back. But I do have an idea as related to some of the other communities we haven't talked a great deal about thus far in this Minority Health Awareness Month episode. Once a week, I go to Mount Pleasant, Michigan. I got that great opportunity to teach at Central Michigan University. And once I get a little north of Flint, I got some windshield time, right? Between like Flint to Birch Run to the Bay Area and further north. I see a lot of rural populations. Let's talk a little bit about the digital divide to an extent in some of those rural communities. We saw where telehealth was brought more to the forefront during COVID, but we still believe that there's a divide when it comes to technology access for some folks that have remote monitoring, for their blood pressure or other devices that they may have. How's Meridian looking to answer and close that gap statewide for folks?
Yeah, it's a really important question. I think you're absolutely right. Not only do we have a digital divide where some members may not have high-speed Wi-Fi, even those members that have cell phones in certain areas, we know all about those drop zones. So one of the ways that we try to address this is by engaging our membership in as many ways as possible, whether that be through a hardline telephone call, whether that be through text messaging if people have cell phones, whether that be email if they do have internet access at home, whether it be snail mail if we need to, right?
Yeah,
for some of those people. And I can give you a specific example of one of the things that I think that we do that could help to close the gap. So for our members that have high blood pressure, we actually have a program where we can actually send out a blood pressure cuff to their home, and if they have a smartphone, they're able to interface that blood pressure cuff with their smartphone, in order to be able to send information back and forth. So that's one of the an example of something that we do to help with some sort of the chronic illnesses that we have. We also, for instance, we talked about pregnancy earlier. For those women who don't have an OB provider right there in their community, we do have what's called a doula program, and a doula is someone that is specially trained to kind of help a pregnant mother get through their pregnancy. And so we have doulas that can go out and access that. So what we really try to do is, no matter what the condition is, we really try to identify the barriers and to try to overcome those barriers with as many programs and as many add-ons as possible.
Wonderful, Doc. Yes, indeed. So our goal every week is to, dive into topics, but as the weeks continue to compound, we cover a vast array of detail, right? And information for folks to create this holistic understanding of wellness and health outcomes, but more importantly, to drive some of those outcomes, to create the awareness and put the resources at arm's length for folks. Speaking of which, we had a mutual colleague on a few episodes back, Dr. Phil Levy and Wayne Health, and how they're mitigating access. And you mentioned their mobile units earlier. We talked a little bit about the Food Bank Council of Michigan. We had them on, and we talked about access to food and making sure that the Gleaners and Forgotten Harvests of the world are well stocked. Housing, as you think about some of these peripherals that are a part of social determinants of health, Doc, how do the lack of them unfortunately drive poor health outcomes?
So I think all of those things are critical, maybe even more critical than the direct care a lot of the times, because that is truly the bottom line issue, right? The issue is not the healthcare itself. The issue is that I can't access the healthcare that I need. And I had the opportunity to meet with Dr. Levy recently, and he is so passionate about cardiovascular disease in the African American community, and we've really had some great ideas about how we can further what he's already doing with the Wayne Health Mobile, and how can we get it into more communities, and how can we do more testing and more screening on the mobile unit. And so we're really certainly actively trying to come up with more and more ideas to get out into the communities to really help to reduce those barriers that we've just identified. And again, earlier I mentioned our website about some of our programs. One of the big things, we have a parent company called Centene in St. Louis that we associate with here with the Meridian. And our chief health officer for our entire company, Dr. Alice Chen, is a huge proponent of food as medicine. It has become a forefront part of our company.
Yeah.
And I think part of it is that we actually learn how to provide healthy meals, but through that vehicle, really teaching people what it is to eat healthy. What is the right portion? What is the right type of food? Sometimes it's hard to access that in the community. So again, if you can get that into the home, then that really, again, is another way that we start to reduce, some of these barriers. So we're really trying to, and reinforcing some of the same topics on our home health show, on a week-to-week basis, I think is important, because it's to learn what to do, you have to hear it over and over again, and we're here to provide that information for you.
Absolutely, Doc. And there's a lot of different ways we could go with a minority health awareness topic, right? Or episode. There could be folks that may feel disenfranchised from the system because there are a lot of isms, but we mitigate, and we are champions, for anyone out there, any race, any creed, any gender, any socioeconomic background. The Home Healthcare Today show is here to engage, to inspire, as well as to inform. Final question, Doc. We have such a great time, man. Maybe we'll have to start our third quarter, July, together with the July episode.
Right on.
Final question as we wrap up Minority Health Month. What's one message every member, whether they're a minority or otherwise, a Michigander right now, what's one message that we want them to take with them from this episode?
I want you to make your healthcare a priority. This is me, Dr. Alvin Haynes, Chief Medical Officer of Meridian, talking to you. Make your healthcare a priority. If you've been thinking about it, do something about it. It does not have to be any grand gesture. Take small steps. The first thing that I would encourage you to do, if you don't have a doctor, please reach out to please reach out to your health plan to get a primary care provider. If you have a doctor and you haven't seen them in a long time, please give your doctor a call up just to check in. That is a perfect way to start. I know lives are busy. I know that there are hard, things that get in the way of that. But we have resources, as I've pointed out earlier, on our website to help with transportation, to help with other things. Really engage. Your health is important. You are important. It's as important as anything in your life. So please take a moment for your health. That's my message to you, to renew yourself this spring.
All right, y'all. Y'all heard it directly from Dr. Alvin Haynes, Chief Medical Officer of Meridian Health Plan. Stay tuned for next week. Next week's episode of the Home Healthcare Today show, we are going to hone in on public health week, as well as Medicaid awareness. You won't want to miss it. Stay tuned. We'll see you next Saturday, 10 a.m.
Really is, life-changing for people that may be encountering those situations with having this type of care and access. And, again, it's any and every one of us potentially. And, what life events happen.